I'm Chelsea Rose. I am the Policy and Advocacy Manager at Care for the Homeless, and I've been here since last July in 2024. My role is a part of the two-person Policy and Advocacy Department, and we handle all of the advocacy work at the city, state, and federal level, which involves making sure that homelessness and healthcare and homelessness is at the forefront of the minds of all of our elected officials that represent us, to make sure they're prioritizing the services and the funding that makes our work possible. I've always known I wanted to help people and kind of be a part of making this world work better for everyone. And I had worked in many different government agencies and different elected offices, and I just felt that policy and advocacy work allowed me to be part of the voices that were demanding change and making sure that people who didn't have the loudest voices were heard in the rooms where decisions were being made. I felt like any organization that claims to be advocating for a specific population should be led and directed by them. So something that really appealed to me when I was interviewing for this role and when I started working was our consumer advisory board, and how closely my position gets to work with them and how much they are really the core of this organization, and specifically the policy and advocacy department. When I meet with elected officials, it's not me telling elected officials why this is such an important policy and program. I'm there, I'm directing those conversations, but at the core of it, the stars of those shows are our consumers, who get to share why our community health centers changed their lives and why the people at this organization have really helped them regain stability and end their cycle of homelessness. So we were in DC earlier in February. There have been, in the new administration, lots of talks about cutting Medicaid and other community health center programs that our organization and the communities we serve rely on. And what our goal there has been is putting a face on community health centers and showing them that community health centers are a cost-saving measure. They do serve communities in a cost-effective way that ultimately saves money in the long run. In February, I brought Cynthia English, who was able to share how when she was experiencing street homelessness, how important healthcare was to her, and the barriers to her accessing it extended her experience of homelessness for so many years, that now her voice is the one that elected officials remember when we walk out the door. It's like, oh, Cynthia could explain to us why these community health centers and the resources and the way that they approach patients and folks who are experiencing homelessness, that is the solution. There are evidence-based solutions that providers have been working on for years, and it's organizations like CFH that need to be in those conversations to make sure that we're pushing solutions that won't further traumatize our populations and extend their cycles of homelessness. We want to end their cycles, and we know how to do that. And so that's our goals when we walk into these meetings, whether we're talking about Medicaid, community health centers, the Homeless Protection Act. One way to keep track of what we are doing at Care for the Homeless is subscribing to our Policy Matters newsletter. We always have calls to action. It comes out once a month. This month, we're featuring Medicaid, stopping Medicaid cuts at the federal level. Medicaid cuts would have such a detrimental impact on our communities. I think we need to do a better job at listening to folks with lived experience, no matter what the circumstance we're in, whether we're reading about a story on the news about an unhoused individual who's suffering a mental health crisis. When we're talking about policies on how to address homelessness, look at where that information is coming from, who is it being informed by, and listen to the people that have lived experience. They are the only individuals that truly know what folks who are living unhoused need. They're the solution to how we end homelessness, and we need to listen to them and center them in every policy discussion, because no one wants to be homeless. No one chooses to be homeless. There are solutions, and homelessness is ultimately a policy choice, and it is our job as advocates to push against that and start making policy decisions that will end homelessness.